Good afternoon, ma'am. I'm John Polakyal, second year nursing student from Pamantasan ng Luzon na Marikina, and I'm going to perform administering oral medication. Why it is necessary? Because it is one of the function of nurse to administer drug to our patient. Second is, so we are able to know if the drug, dosage, route, or how the patient will take it, and the time and frequency if of the drug if correct. Before I start, I'm going to perform hand hygiene to reduce the risk of transmitting microorganism. And the next is I'm going to verify the doctor's orders of prescribing drugs by comparing it to the MAR. MAR. Before I comparing it, I'm going to identify the client by the MAR. Mr. Jean Michael Mira, okay. Date birth, January 31, 2000, okay. January, okay. And then check if the patient has an allergy in the medicines or having hard time swallowing medicines. In my case, Mr. Mira doesn't have any allergies and doesn't have having hard time in swallowing medicines. Okay, I'm going to proceed to comparing the doctor's order in the MAR. The first is ascorbic acid 500 mg PO per day. Okay? Ascorbic acid 500 mg PO per day. Okay, check. Next is mucotus. Mucotus 10 ml PO per day. Excuse me. Mucotus 10 ml PO per day. Okay, check. After comparing the doctor's order into MAR, next is I'm going to compare the medicine which I'm going to get into the medicine cabinet. The first medicine is ascorbic acid. Ascorbic acid 500 mg PO per day. Okay, check. And then mucotus 10 ml PO per day. Okay. And then always check if the expiration date is not, always check the expiration date. The expiration date of ascorbic acid is December 12, 2022. So, in my case, it is not expired. And also check if the medicine is intact. Okay. Okay, then. And then next is, okay, not expired. Next. Then check and also check the expiration of the mucotus. In my case, the expiration of mucotus is December 12, 2023. Okay, so it does not expired yet. And then next is I'm going to compute for the dosage of the medicines that is prescribed. In my case, the written in the MAR is 500 mg PO per day, and the medicine that is given to me is 500 mg, so it is good. Okay. The next is the mucotus 10 ml. 10 ml which I will be computing later. Is put the medicine into the medicine cup, and don't open it yet unless the patient will now drink it. Okay, next is I forgot. Always double check the expiration date of the tablet, so it doesn't lead into a medical errors. Okay, the expiration date is December 31, 2022. Okay, put it in the medical cup. And then next is the mucotus. The written in the in the MAR is 10 ml only. In my case, the medical cup has a labels, so I can easily compute it. Put the medical cup in the flat surface and label it into your eye level so you can see it. And then open the container of the liquid medicine or the mucotus. Put the cup in a flat surface, positioning upside down so it cannot be contaminated. Okay? And then that's what I say earlier. Locate the ml side of the measuring cup and then slowly put 10 ml of mucotus. Okay, it's already 10 ml. Okay. Before you close the container, you need to wipe the lid of the container of the mucotus so it will not be contaminated. And then close it and put it back into the cabinet. Okay, ready to transfer to the patient, but always remember, if the liquid medicine is less than 5 ml, in that case you will be needing you are going to need to use the syringe that is measured 5 ml, but don't forget to label it with the name of the drug and how many the time, or label the drug name and the time and the frequency of that drug. Okay? And then after all that procedure, I'm going to document, because it is the most important thing. Because if you done your duty and the next nurse enter the room and you don't document it, it will lead to the nurse will give it again to the patient, so it can lead to medical errors or overdosing the patient. And then lastly, I'm going to perform hand hygiene again, because I touch medicines, so it can't be contaminated. That's all. Thank you.